the news and information you need from the people making a difference. This is Comcast Newsmakers.
I'm so glad you stayed with us because there are big findings in terms of surgery to treat prostate cancer. Hello again, and thanks for joining us. I'm Carla Showell-Lee, and you're watching Comcast Newsmakers. Joining me this hour is Dr. Francis Shanne. He is a urologist for St. Francis Hospital, and today we're talking about the Da Vinci prostatectomy surgery. Thanks for joining us today.
Thanks for having me, Carla.
A lot of big words in there. I think I got everything out, doctor. But this is interesting. First of all, what does a urologist actually do?
A urologist is a surgeon who takes care of urologic problems. That can be things like kidney stones, cancers of the urinary tract, including prostate cancer, kidney cancer, and bladder cancer.
Okay, I'm sure you've had to treat a lot of patients that have been stricken with prostate cancer.
Absolutely.
Okay, and what is prostate cancer?
It's the most common form of cancer in men, and it's one of the leading cancer causes of men in terms of cancer deaths.
Okay.
And prostate cancer is a cancer in the prostate gland, which is an organ just below the bladder. It surrounds the urethra.
There are three big concerns if you are diagnosed with prostate cancer that people have, right?
With prostate surgery, the main concerns after the surgery for prostate cancer is cancer control, preservation of sexual function, and the preservation of urinary control.
That's why some men opt to not even get it treated if they're older.
That's right.
Right.
Some men will opt not to have it treated, or some men will opt for a different type of treatment, such as radiotherapy. Radiation to treat the prostate comes in multiple forms, and it's an excellent cancer choice for some men. But prostate cancer, if it's treated with radiation, you could have a recurrence, and you can't treat that recurrence with surgery. But if you treat it with surgery, you could still have a recurrence, but you can then treat that recurrence with radiation. So it kind of gives you two tools to treat the cancer with. It gives you a better chance of beating the cancer, especially if it's an aggressive cancer.
Okay, so for an older adult male, if he has prostate cancer, he might be taken out of this world faster by something else than maybe the cancer itself.
That's
Is that true?
Some men do not necessarily need to have their cancer treated, but that's a very complex dialogue, and that should be something that a patient should review with their urologist.
Got it.
Most men diagnosed with prostate cancer are at risk for dying from their prostate cancer, and they really do need to seek treatment.
Mm-hmm. Okay, so tell me about this very long word, Da Vinci prostatectomy. Is this a new surgery?
Relatively new. It's only been around for 5 years. It's the same surgery that's been around for decades, that is surgical removal of the prostate, but now it's being done with a different technology, a technology that allows us to do it in a less invasive way, that speeds the recovery, gets the patient out of the hospital much faster, less downtime, less recovery time, less pain. And we're also finding now that some long-term things are improved by the Da Vinci prostatectomy over open prostatectomy. Those three big concerns that we talked about earlier are all positively impacted by the Da Vinci prostatectomy over the open technique. Cancer control, this is early, it appears to be better in terms of cancer control as much as we can measure that within 5 years. It definitely has a positive impact on preservation of sexual function, which for a lot of men is extremely important in terms of their treatment choices for prostate cancer. And it also appears to have a very positive impact on urinary control. And those are really the three big things that we're looking at as a patient recovers from prostate surgery. So it's a marvelous change in the way that we provide this treatment for prostate cancer.
This is a very delicate topic. I'm sure that you don't have a lot of men who come into your office and speak about this so freely as you do.
Well, more and more are doing that. Some are being pushed a little bit by their loved ones, but men are becoming more open about talking about it, and there are some marvelous support groups available that make it easier for men to talk about these issues. If you are diagnosed with prostate cancer, there are support groups that are willing to sit down with you, men that are available that have had the diagnosis and have had one of these treatments, and they could talk to you about what it's like to go through that.
Right, because some people could be living with prostate cancer right now and don't even know that they have it.
That's very true.
And I know you can go on the website and find out some of the symptoms that might be involved in surrounding
Well, that's an important
cancer.
point, and actually prostate cancer, especially early on, has no symptoms, so it is important to get screened for prostate cancer.
Good information. Thank you so much, doctor.
Thank you.
This hour's newsmaker, Dr. Francis Shanne. He is a urologist for St. Francis Hospital. I'm Carla Showell-Lee. Thanks for watching.